being here tonight at Savvy Women. I'm Kimberly Parker, Executive Director of Sierra Nevada Memorial Hospital Foundation, and this is a Savvy Women program. I do want to take just a moment and reflect. We have a slightly smaller audience tonight because we've had some real devastating things happen in our community, and quite a few women that very, very rightly said, you know, they either were dealing with their own personal challenges or tragedies, and or they were helping someone else. I think it's amazing in this community, you know, people putting on Facebook and other places, I have a room, I can take your pet, I can do this, I can do that. And so I just want to say, you know, my thoughts are with anyone tonight who are dealing with people here or in other communities. This has been kind of it's been a difficult month with everything happening all over different places and the things happening here. That's why things like Savvy Women are so wonderful, because it's meant to inspire and motivate and help us believe again in things and help us feel good about things. And you know, I think we just need to have those moments of reflective pause, and then we need to also kind of just roll up our sleeves and start all over again. And I think that's what we'll start to see in the next coming weeks with our community. So thank you all very, very much for being here. I'm really excited for this program tonight, but I want to give just a few quick updates, if I may. A couple things that are coming up that you may have an interest in. One of the things is on October 18th at 5:30 p.m., we're actually offering a tour of the Diagnostic Imaging Center over at Sierra Nevada Memorial Hospital. This is kind of an interesting behind-the-scene look at all of our women's services, our breast services, our CT, MRI. You get to go places that you normally can't go and hear about things that don't always get talked about. It's about an hour tour. It does include wine. And all you have to do is call the office and ask to be added to the list. It's open to anyone, so this is not just for women. If you have a spouse or someone else that might be interested in going as well. It's a very interesting tour, and I always tell people when we do tours of the hospital, these aren't like how you get around the hospital tours. These are things that are very, very interesting going on that we want our community to know about, and we've got a lot to feel proud of, and there's a lot of services there that you may not be aware of that we really encourage people to participate in. And I think there's also a sign-up sheet by check-in, so on your way out, if you think this is something you'd be interested in doing, you can sign up there as well. If you're not receiving Savvy Women notifications and want to, there are contact cards out front, and we encourage you to feel free to go ahead and fill that out so you can hear about all of our Savvy Women programs. A fun one that we have coming in late February, and this is unusual because usually Savvy Women is all about the savvy women in our community, but we're actually doing at the end of February, Savvy Women and Wise Guys. And this is being planned. It will be with our new Chief Medical Officer at the hospital, Dr. Rosenberg, who is a cardiac and thoracic surgeon. And we're going to have a panel here of cardiac people, and the discussion is going to be on your heart health. And as we know, cardiac issues and heart issues are important both for men and women. So we're encouraging you all to bring your male husbands, friends, companions, etc. along with you for that one. March 15th, we have Kim Allen Jones, and her topics: love to eat, love to travel, make Peru your next foodie destination. And more to come at a later date. We also have at the Hospital Foundation our Midnight in Venice biannual gala, which is November 4th. We still have reservations available. This is a masked ball, and it's going to be quite spectacular. Antonio's the caterer, and there's dancing and dinner, there's a live auction, and it's to benefit emergency services at the hospital. So a lot going on. So as I always do, I'm going to just say, you know, look around for just a second. If there's someone near you that you don't know, just turn and introduce yourself. This is also an opportunity just to meet someone new. So I'm going to just let you go for about 30 seconds to introduce yourself to someone around you that you don't know. Oops, we lost our PowerPoint. Oops, we're back. Okay, I think that was our signal. Thanks, Gail. And right on with the program then. It's my pleasure. I want to acknowledge our sponsors for tonight. We have the Lee and Dunn group with Baird. And I don't think I saw Jan. Oh, yay, there she popped in. Hi there. Thanks for being here tonight. Janice is also part of our Savvy committee. Thank you. And Concierge Accounting from Cornerstone. And I'm looking at this. I love the language on the brochure, and I know Kelly and Kimberly are here, I think right in front of me. They're incredible services. They are presenting sponsors. Concierge Services for Women, Managed Cash Flow for Powerful Women. I love that. And I open this up, and the first thing I see is you manage an empire. Do you really want to manage your checkbook? So these brochures are out front. I hear so many incredible stories about these ladies and the services they do. This is the Concierge for Women is one of their services, but they do so much for our community, and we're so grateful to have you as our presenting sponsor. Thanks so much. And as always, we want to thank the Center for the Arts for allowing us to be here, and the team that help us get all set up every month. So thank you so much. But I do want to now introduce our speaker tonight, and I got to know Justine a few years ago. I am going to read her bio because, oh my gosh, I could never remember this. But I just have to tell you, this is an amazing, amazing woman. And she's going to kind of talk about some of the things that we're doing for our community. But Justine Corbett is a doctor of Oriental medicine. I think, honestly, for me, it was the first time I actually saw the initials OMD, and it took me a minute to figure it out, but I got educated very quickly. A licensed acupuncturist, a diplomat in Chinese herbology and acupuncture, a certified massage therapist, and a Reiki practitioner. Dr. Corbett has a doctorate of Oriental medicine, a master's of science in Chinese culture and health services, and a bachelor of arts in international relations. And plus, in addition to that, she's a contractor. I think she's been doing a lot of work around the area. She's an amazing woman. She is here to kind of talk to us about when traditional medicine and complementary medicines integrate with each other, and the amazing results that we can start to see with that. So with that, Dr. Corbett.
Can everyone hear me? Oh yeah, that's great. Hello, welcome. Thanks for coming out tonight. I know with everything going on in our community, I wasn't expecting anyone to come out tonight. I live in Lake Wildwood myself, and I got evacuated, so I wasn't sure I was coming out here tonight. So I wanted to thank everyone. So last night, well, no, not last night. At about 4 o'clock in the morning the day before, my neighbor came pounding on our window saying, get out, there's a giant fire. And it was pitch black because all the power is out down there. So I basically just grabbed the clothes that were on the floor that had come off the night before, and I had the t-shirt that I was sleeping in, and we left the house. And in the back of my mind, I was thinking, you know, the grandmother's adage, always make sure you have clean underwear on when there's an emergency. And I thought, well, I don't have clean underwear on, and all I have are my dogs and the clothes on me. So, you know, flash forward to today, I didn't grab the notes for this lecture, and I thought, oh, I'm just gonna have to wing it. So flash forward today, I wasn't sure I'd be able to get home to change. So I had a t-shirt on. It was bright green, giant t-shirt. It had a bear, and it had an elk, and a beaver on it. And it said, nature and shit. And I thought, well, this is appropriate for the fire, but I'm not sure people take me very seriously as a doctor if I'm wearing that t-shirt. So luckily, they let us into Lake Wildwood right before I got here. I was able to throw on some semi-decent clothes, and here I am. Yay! Yay! I'm a little tired, so you'll have to bear with the brain fog. So I'm Justine Corbett, OMD. That's Oriental Medical Doctor, and I have a little bit of a cute story. After I see patients, I type the notes up in the medical records so that the other doctors can read what I'm doing, and I can read what they're doing. So I usually start with referring physician, and colon, David Campbell, comma, MD. And then I start with myself, Integrative Medical Consultation with Justine Corbett, comma, OMG, and sent that out. And then, I was kind of laughing at myself, and I thought, well, it kind of is OMG to have a program like this in our little community at our hospital is really phenomenal. And I say that because I go to integrative medical conferences, and there's always Harvard Medical School's there, and UCSF is there, and UC Davis, UC San Diego, all of the big hospitals and teaching institutions, but you never see smaller hospitals there. So this program, it's phenomenal. We have it in our community. And I'm certainly not taking all the credit myself. It takes a village, right? It takes a village. So the doctors have been on board from the get-go. Without their support, this program would not work. So the oncologists, the radiation oncologists, Dr. Krause, Dr. Campbell, Dr. Evans, Dr. Hung are on board with this program. Also hospital staff. So the nurses and support staff, Linda Ashleman has been a part of it since the get-go. It's been a long process. And then there's the foundation. Without their help, Kimberly Parker and Sandra Barrington, this program wouldn't be here either. The community supports it, the doctors support it. You have to have that kind of magic ingredient for something like this to work. So I don't think everyone's aware of how, what a big deal it is. So you got a little bit of my background, but I won't go into that. I did, after I graduated from Chinese medical school, I started working at Berkeley Family Practice because I'm from down in the Bay Area originally. And I set up their acupuncture program. It was a very busy practice. They handled all the workers' comp cases for Berkeley Fire Department, Berkeley Police Department, all the Cal Sports teams, San Quentin prison workers, a super, super busy practice. And when I first started, the doctors thought, well, why would we refer anyone to you? Like, what do you do? And so I thought, these drug reps are coming in, and they're taking an hour to talk about their drugs, so why don't I take an hour to go in and say, well, these are the kinds of things I treat. So after several months, not only was I getting, I was getting patients and they were seeing results, and finally all the difficult patients, they thought, well, I don't know what to do with this person. Let's give it to Justine because she can handle it. So, and then the doctors started seeing me. So it was this kind of an avalanche, and it takes a while getting it going uphill, and then it's a pretty quick downhill. The past 15 years, I've studied functional medicine, and that's kind of a subset of Western medicine. It's really looking at lab parameters, and it's trying to catch disease before it progresses to disease. So you're trying to catch, through looking at labs, trying to catch symptoms that maybe will progress eventually to disease. So like metabolic syndrome before it develops into full-blown type 2 diabetes. So that was kind of bridging that gap between my training and knowledge with Chinese medicine and also the Western medical piece. The other thing that people don't realize is when you study Chinese medicine, you have to do pre-med, which is Western, and you have to take a lot of core courses in Western medicine. You have to know how to talk about disease and understand the language, so physiology and anatomy, and we had to learn, about all the medications and whatnot. So 6 years ago, this is a little more personal story. 6 years ago, I was diagnosed with breast cancer. Giant shock, because I thought, I'm so healthy, I'm like Miss Integrative Acupuncturist, and I had a fairly healthy diet, so it threw me for a loop. So when I was in meeting with Dr. Kraus, my first meeting, he said, so, okay, what do you do? And I said, oh, I'm a contractor. I do construction work. That's what I said. I do construction work. My husband elbows me and says, she does not. She's a Chinese medical doctor. So Dr. Kraus said, you are? We need you. Hurry up and get well. We need you to start this program. So he was really the first person that I met at the hospital that thought, okay, let's get this ball rolling with this program. I went down the hill, I had second opinions, I went to UCSF and saw some fancy doctors there, and I went down to Roseville, I saw some doctors there, and I really liked the team that I had here. There was something so personal, heartfelt, they took the time, it just felt right to me. And so I had all of my treatment done up here. And I'm now working with them and love it. So I'll get a little bit into Eastern medicine, East meets West. I come from a tradition of Chinese medicine, but up here we have an Ayurvedic college. So I have to kind of include that into my talk. Ayurvedic medicine actually came from Chinese medicine. It's a subset of Chinese medicine that traveled over to India. And the thing about Eastern medicine in general is it tends to be very individualistic. It looks at the person as an individual. So with Western medicine, and this is shifting somewhat, so I want to bracket it with that. With Western medicine, there are these studies, they prefer large groups, and they'll try a medication or some kind of diagnostic technique, and they'll do these studies, and 50, 60, 70, 80% of the people respond well. That's great. But there's the people left in the fringes that are still there. But it tends to be like, if this works for most people, this is good. So it's not necessarily individualistic. So with something like Ayurvedic, they break down people's physical form and also mental form into the 3 doshas. Any Ayurvedic practitioners out there? Good, because I'm not an expert. So they break down into the 3 doshas, meaning there are 3 basic body types: Vata, Pitta, and Kapha. And they all have different attributes. In Chinese medicine, things are broken down, much further than that. The very basic one is that you've all heard of qi, hopefully. We're in California. So there's qi, and that is energy and functionality. It's bigger than energy. It's not just energy, and it's a very difficult word to translate. So there's qi and there's congenital qi. That's what you're born with. So that, that roughly equates to genetics, which is a big deal right now in Western medicine. And then there's acquired qi. Now that's the qi that you acquire through life. And there are many, many things that contribute to acquired qi. So that's diet and exercise and sleep and all of the things that really contribute to our health. Stress and our mental outlook, etc. So they also have organ system differentiation. So in Western medicine, the organs have particular functions, and you really just study the organ. In Chinese medicine, it's a little bit different. So for instance, the kidneys connect to the bones, and they connect to knees and lower back. The emotion is fear for kidneys. So that's a system. It's the kidney organ system. The liver is an interesting one. The liver connects with breasts and eyes. And the emotion of the liver is anger. So we're talking about breast cancer. This program is with the Cancer Center working with breast cancer patients. And so liver, breasts, eyes, anger. So there's, there are a lot of studies on the emotional component of breast cancer and all cancers and all diseases, frankly. So the other thing that Chinese medicine breaks down pretty much the whole universe into are they classify everything, yin and yang. They spent 4,000 years arguing about this stuff. Well, what's a chair? Well, what's this microphone? There's hot and cold, yin and yang, masculine, feminine. It goes on and on and on. So that's another way of being a little more individualistic about looking at things. So I want to connect that into breast cancer a little bit. So in Chinese medicine, chemotherapy is a cold modality. And radiation therapy is a hot modality. And that kind of makes sense. Radiation is hot. So if you're a person that has a cold constitution and you add more cold to it and you get chemotherapy, then you're probably not going to do very well with it. More of the negative side effects will start to show up. On the flip side, if you're a hot person and you have radiation therapy, then more of the negative side effects of that are going to show up. So it's wonderful if you combine the two and you take into account the person's constitution, then you know how well they're going to deal with the treatment they're getting. Now that can be supported. The whole idea of integrative medicine is to try to bring things into center. So if someone's hot, you're trying to bring them more to the cold side. If they're cold, you're trying to bring them more to the hot side. So I want to mention juicing. Everyone's like, juicing, it's so great. So if juicing's very cold, it's especially most of the vegetables. You can add things to warm it up. You can throw in your turmeric and your ginger, and that, tends to warm it up. But juicing is cold. It can be hard on digestion. So for someone with a cold constitution, juicing is not the be-all, end-all for them. And for someone who has a warmer constitution, they're going to respond really well to juicing. So that's just another example of we need to think about the individual, not just about what the be-all, end-all and what works for everyone. So I want to talk a little bit about what is an integrative medical consultation. What do I do? So I get the referral from the doctor, and then I start to do chart research, and I really try to research their medical history. That could take 1 to 2 hours. I get thick charts, thin charts, and I'm really looking for a common thread throughout, and that will help me direct them to different modalities. So I think of health, all of our health. I draw 2 really lame pictures when they come in for the consultation, as I'm not an artist. One is a pie. I just draw a circle, and it's cut into pieces. All of you have different size pieces in these different areas. So I look at diet, I look at nutrition, emotions, exercise, stress, the thoughts you think, your mental outlook, genetics. I look at family history, environmental factors. Where did you live? Your whole medical history that I have access to. What I don't have access to, you would fill in. The other lame picture I draw is of an iceberg, because I really visualize disease like an iceberg. So the tip of it are the symptoms we present with. That's disease. We go to the doctor for that tip of the iceberg, right? I have a headache, I need an aspirin. It's a symptom that you go. But underneath is the mass of the iceberg. And that's the biggest part. And I look at that as all the things leading up to the tip of that iceberg. What are all the causative factors of disease? So Western medicine tends to focus more on the tip of the iceberg. Integrative practitioners tend to focus more on the base of the iceberg, so the causative factors. And I think both offer a beautiful blending. I'm not called an alternative medical practitioner because I think both systems have these incredible strengths, and bringing them together, to me, is the best way to address health issues. We each have something to learn from one another. So I formed an advisory board, and this part was really exciting. So the doctors and nurses, Linda Ashelman's on it, and some of the administration is on it, and people from the foundation are on it, and practitioners out in the community are on it. So we can create a dialogue between the practitioners that are alternative, that are really should be integrative, and the doctors who don't necessarily understand what all of these people do. Most of my patients are seeing other people, right? Oh, I have a chiropractor, I have a this, I have a that. Who's really looking at the whole picture? You know, who is looking at and coordinating the care of all of these people? So it's important to have that dialogue going between the doctors and practitioners. And you know, the advisory board meeting is a way to make that happen. So before this program started, I vetted a lot of practitioners in the community because, you know, we have a rich, amazing community. People are practicing all sorts of stuff here. And it ranges from like way out to super alternative stuff to very, very traditional stuff. I was trying to go for the middle zone, maybe because I'm a Chinese medical doctor and I'm trying to bring things into balance. So I was trying to bring in people that can work together, that can dialogue, that can understand, that are professional, that have licenses that they keep up, that use, you know, proven modalities, and have a lot of experience in their field. So I spent a lot of time vetting those practitioners. So after I have the consultation with a patient, I try to connect them up with practitioners and modalities in our community. I offer advice, dietary advice. I look at the supplements they're using, the medications they're on, and I try to give advice based on the patterns that I see in their charts. The consultation's usually an hour and a half. I've even had a 2-hour consultation. And you know, these breast cancer patients are not coming in just with breast cancer, right? No one says, oh, I've never had a problem, now I have breast cancer. They have, you know, maybe their knee was hurting them, maybe as a child they had a concussion, maybe they have lung problems or they have diabetes on top of it. Some of them are on a ton of supplements, some are on a ton of medications. There's really a wide range of patients that are affected by breast cancer. It's somewhat of a mystery, you know, that range. Anyway, I direct them to practitioners that I feel can help bring them into balance, to make their slices of the pie a little bit more even. People need exercise. If that piece is missing, we have a Qigong practitioner. Anyone can do it. You can be in a wheelchair and go in and do Qigong. So I also try to pick modalities and work with someone's economic level. Not everyone can afford to go see all of these practitioners, some of whom insurance doesn't cover. So I try to make it affordable as well. I'll just kind of wrap up with, it takes a village. It really has been this incredible coming together over 6 years, dialoguing, business proposals. The team has shifted sometimes, but it's just amazing. I'm in awe of this community that a program like this exists here, and I'm really proud to be a part of it. I consider this kind of the cherry on my Sunday. So yeah, thank you for coming out, and if you have any questions, I'm open to hearing some. Yes?
How do you tell if a person's hot or cold?
So that's a complicated question,
okay.
but there are, so
Consultations.
I'll give you a couple of examples. So usually colder people, it's not necessarily, oh, I tend to feel cold all the time. That can be true sometimes, sometimes not. Usually they have a more sluggish metabolism. Usually they're heavier because they have a more sluggish metabolism. If you talk to them about the things that make them feel good and not feel good, you'll notice that warmer things tend to make them feel better. They tend to not, and it roughly correlates to some of the Ayurvedic stuff. So a hot person is usually thin, super busy, never sits down, talks a lot. And that's, we don't always fall into these exact categories, but there's a way of determining, and most people are predominant, right, one way or the other. But the other thing is, if I see a patient and they are not doing well with chemo, and they present with a lot of this cold stuff, I can just assume that is a cold constitution. They're presenting with all of these, symptoms. And there's a way to balance that. So the beautiful thing is, they can continue to do their required treatment regimen without going off and be brought into balance with other modalities. So that's kind of the strength of it.
Another question.
Yeah.
Do you work by referral?
I do. So at this point, the doctors in the cancer center refer the patients to me. And I get patients who have had cancer, breast cancer, 20 years ago, and they can come see me. Yeah, so you would have to see the oncologist. They make a referral to me, and that's how it works. I think I'm going to get the woman next to you just because she had her hand up first.
It was the same thing. How do you figure out what your constitution is?
Yeah.
Because I have a juicer that's been collecting dust in my pantry for a long time. I don't know whether to put carrots in it or apples in it.
Yeah, I think I try to go for balance and also season, right? So do you want to drink some cold, frothy thing in the middle of winter? No. So broths tend to be better in the winter. So the Chinese are very conscious about always thinking of balance, thinking seasonally. So, don't get apples from Chile, in off-season, or pineapples in off-season. Get them when they're full of phytonutrients in the season that they're grown, and then juice those. If juicing hurts your stomach a little bit, add some warming things. See if it helps. Turmeric, ginger.
My other question was in practicing Chinese medicine, because the cultures are so different.
Yeah.
What is your most common recommendation to people to sort of get on the path of what's the biggest disparity, I guess, you have when people present themselves with an issue? Is it a Western caused issue that you try to correct with Chinese medicine, or is it?
No, I don't think it's not a Western or an Eastern. It's a diagnostic method, right? So Western practitioners tend to rely much more on science and technology. Chinese medicine's been around for 4,000 years. They didn't have MRIs, they didn't have stuff like that. It's been tested over time and through experience. And so that's fantastic. You're bringing together the old and the new. And it's really a wonderful blending. Yes?
So my question was, you mentioned that you wanted to use sort of these proven modalities, and I'm wondering how you assess what's in, what's out, what are you including in your...
Yeah, so I think I prefaced that with, I kind of aim for the middle, right? So there's always someone, I had breast cancer and I rub mud on my breast and I'm cured now. And then someone writes a book about it. And I'm not saying that didn't work for her and it's not possible. We're all individuals, right? We're individuals. So what works for Jane is not going to work for Joanne, right? So I try to bring in, as I said, modalities that have a little more science to them. There are more studies. Maybe they're a little more accepted by the Western community. I'm expanding and looking at it all the time. I'm looking at, because new people move to our area, right? They're great practitioners that keep coming to our area. So I'm not just keeping this lockdown on certain practitioners. I like to hear from my patients. Who did you see? You know, what was effective for you? And then meet with that person and see if they kind of fit into the program. So if someone says, Western medicine is bad, I refuse to have my patient see, they're either seeing their Western doctor or they're seeing me. They're not seeing both. That's not someone who's going to participate in this program. It's not being integrative. So the other thing I look for is, a lot of people come in, they have a lot of skills, but maybe they've only done what they do for 2 to 3 years. Well, I would rather get someone in who's done something for 30 years because they have more experience with it. I want to make sure that they're licensed in what they do, right? There are a lot of people testing things out, but I want people that are licensed. In the case of acupuncturists, for example, I have 2 there are many, many in the community. I have 2 primarily that I refer out to. They both are cancer specialists. They have 25, 30 years experience. One works down at the Sonoma Cancer Center. Unfortunately, she may not have an office anymore. But they have a lot of experience. So those are the types of people that I, really want to include in the program. Yeah. Yes?
You mentioned, I heard exercise somewhere, but like things like yoga or things like walking, or is that integrated also? I mean, you mentioned exercise.
Absolutely.
But does that, and some people can't maybe for whatever reasons, but I just wonder, where does that kind of fit in? Does that kind of fit into the program, not the program, but the
Yes.
what the person's going to do, their regimen,
Yeah.
what they're doing?
Yeah. Once again, it's about the individual. What is their capability? I have people that come in that are triathletes, and they, they have a double mastectomy, they're going out swimming, and I say, no, slow down, let's take time, heal properly. I have people that are severely obese or very elderly or handicapped, or, they have a hard time walking. So then something like Qigong is great. Tai Chi is great. Qigong is something you can take your own body energy and work on your own healing process. Anyone can do it. I have a patient, she has COPD, and she brings her little tank in, she wheels it in, she does Qigong. She's getting better and better and better. She's working on her lungs. We have a great practitioner of Qigong up here, many actually. And he offers a class for $5. The first one's free, so anyone can afford it. So I try to take into account the person's physical level, the person's economic level, and I think the hardest part is actually talking about spirit and feelings. That's the hardest part, because some people are very religious, and there are a whole assortment of religions there. So I certainly can't say, oh, you need to go, practice this form of spirituality. It'll help with you. I have to take into account everyone's, desires also. Yeah.
So going back to that, where your knees are connected to different parts.
Yeah.
When you deal particularly with the breast cancer area and the anger, like you said, I think anger.
Mm-hmm.
Do you have a practice in which, or what is the process for, where you begin to have conversations about what makes you angry, or how are
Yes.
you carrying that? Is that
Yes, absolutely. And for whatever reason, I was born very intuitive. I have a strong intuition. Sometimes I'll get a woman walk in the office and fear. It just bowls me over how much their life is dominated by fear. And I try to tease it out because, it's hard to talk about stuff like that. If you go poking and you're aggressive about it, someone will just, go back into their clamshell, or they'll feel threatened. I have difficult issues all the time. Some are addicted to substances, alcohol, bad relationships. How do you talk about that? The toughest thing to talk about is death. Well, how do you feel about death? What if you're okay with what's happening with you, that you accept that? That's a really hard thing to talk about. And admitting it doesn't mean you give up because you admit you're okay with the prospect of dying. So they're very, very difficult conversations. And sometimes I think, what am I doing? Help me, someone. And that's a tough one. I will say that emotionally, I noticed two patterns with breast cancer patients. One is that women, I think in general, women have a harder time expressing anger. They express sadness fairly easily, but anger's tough. And for men, it's the reverse. They can be angry, but being sad, it's hard for society to kind of support that. So a lot of the women that come in, I think, have anger issues, and they just don't know how to express that. They're not getting the support to express that. The other dynamic I see are women who just don't talk about any emotion. They are just in lockdown mode, and my life's great, everything's great, it's great, and you can just see that things are not great, and they are not talking about it. And that it doesn't always come out in one consultation. It doesn't, I try to tease that out. Yeah. Anyone else?
One last question.
Yes?
Can primary care refer them to you for a breast cancer patient?
So usually what happens, kind of the chain of command thus far, is that primary care, when a primary care doctor has a breast cancer patient, they usually refer them to an oncologist. Then the oncologist refers them to me. Or they get tested, they see Linda Ashleman. I've gotten some referrals from Linda Ashleman. I work with some primary care physicians also. So, but generally they see the oncologist first. Yeah. Are you a primary care physician? Silence. Okay. We can talk afterwards. Yeah. Anyone else? Great. Thanks again for coming out.